Welcome back. I'm glad you're still with us here on Morning at NTV. We shall be going into a business update, a look at how improved health economics can translate into a more productive economy as the population is able to do the work that they are supposed to be undertaking without necessarily going into the pitfalls of failing on account of health. I have with me a gentleman, very interesting preposition that he has and what he is doing. I'll be introducing him very shortly. But health systems are important contributors to better health outcomes as well as well-being for humans. They also are central to the effective functioning of an economy. Many times presidents, including Yoweri Kaguta Museveni, have spoken about the need to be healthy and maintain a lifestyle that does not endanger your own health in order to stay productive. In addition, when viewed as economic sectors, health systems are a major source of employment and also do produce goods and services that directly contribute to economic growth. The World Bank does a whole lot of look from an eagle eyes point of view on how we do perform, but James Yiga, a director at Light Travel Consultants, has an interesting proposition and a business angle to this. You're most welcome to the program, Mr. Yiga.
Thank you very much, sir.
First and foremost, tell me about, you are a travel consultant.
Yes.
And here we are speaking health economics.
Yes, sir.
What is the convergency?
In travel, we have a department that does medical tourism.
Medical tourism.
And we started when we were enabling patients access international medical treatment. But then, from the researches that have come out, we came to the realization that we can do much more to help find answers to some of the challenges that challenge the health sector.
Yeah.
So we decided to form a formal department in our company, and which now we formalized as a formal company called Daylight Medical Links.
Okay.
Where we're trying to make it accessible for every patient that desires to seek a second medical opinion from a specialist, from a medical specialist.
Okay.
Yes, so that is how we're a travel agency, but came into the medical sector.
Of course, that being informed by maybe the numbers of clients who are seeking medical treatment abroad, but had to use the travel tickets.
Statistics have it that the number of patients that are traveling internationally out of here to go and seek international medical treatment, definitely the causes of that are visible. There are so many people who are suspicious because of the challenge that we face. But I'm a proponent of finding a positive way of how we can all be responsible to find a solution.
The solution,
to try and support the health system and the health sector to make sure that we can save a life. We cannot wait for anybody to come and save us. So what we are doing, what we're trying to do is, from experience, we realize that there's something that we can do that can save a life, and in that we decided to create a platform where patients, especially those that have gone through enormous pain over time, they've been getting treatment that probably they don't get any relief, to access medical specialists on our platform, because we are in a position to identify for them which specialist is appropriate to get them a proper treatment plan so they can recover their life.
All right, so
yes.
You are essentially the bridge between the patient or the client in
and
this particular case and the medical specialist.
Yes.
So that means you have a catalogue of medical specialists across the globe.
Yes.
And the cost that comes with seeing them.
Yes.
So that a client can quickly figure out who they can see, or rather which doctor they can afford and who they can't afford.
We have partnerships with the best hospitals locally and internationally.
Okay.
And when we are selecting those partnerships, we make sure that we vetted them, we visited them, We know their potential. We know the kind of skills that they have in terms of how they can treat patients. And so we are in position to identify which hospital and which specialist is the best in a certain ill condition. But personally, I'm a health enthusiast. And I became that after having survived a very life-threatening battle. Back in 2014, I started getting complications in my stomach. And right now, I survived, and I attribute my life to two major factors. I survived first because of chance. I was lucky to get somebody who saw me at the time of my worst to recommend me to a medical specialist that understood my condition, that did a diagnosis that understood my condition and gave me an appropriate treatment. And then secondly, I got an opportunity to seek a second opinion because I'd been diagnosed with a redundant sigmoid colon that was severe, and they were telling me that the only solution would be a surgery, that they would trim it and probably fix it. But the reason as why I call it survival is that I have a friend of mine who was Kenyan but used to work in Uganda and Kenya at the same time, who we discovered had the similar condition. And for him, he accepted to undergo a surgery, which eventually never succeeded on the third time of an operation, and we lost him. So imagine having a friend dying of a condition that you're having, and when you're stuck, you don't know what to do, and you see yourself imagining that you're the next to move. So I was saved because of a second opinion consultation that I had with a specialist. And then I realized there are so many people who suffer in the same way I was suffering, but they don't have access to the specialist to be diagnosed, to establish and determine what is really giving them the illness so that they can determine for them a proper treatment plan. So that is how we came up with the idea of trying to create a platform where we can enable people, patients who want to seek proper medical attention, who want to seek second opinion consultations from specialists, so they can access them and probably get to recover and have a second chance to their life.
Okay. Yes. Does the portal or central depository of information about doctors and hospitals across the globe, does it sufficiently share the cost? Is that something that is readily apparent to the client? Because one thing is for sure, as a Ugandan, your thoughts when you are dealing with a debilitating condition, you're oscillating between the cost and the probability that the Lord God will, of course, be have favor upon you. Do you advise that? Because it is very important for somebody to know not to embark on a process of seeking medical attention abroad and then entirely depend on handouts or fundraisings, for example.
We from the latest studies that were conducted, there were so many reasons why people were dying. There's a study that was conducted by the Investors University, and it was funded by the Investors University members. They were appalled at the rate at which their members were dying. So they decided to fund a study to determine why is it that their members were dying prematurely. Yeah. So when they did a study, they came to the conclusion that 8 out of 10 people that died every day, that of their members that died, 8 out of 10 died prematurely from avoidable illnesses, and at the same time, because they lacked access to proper medical treatment. And one of the factors was that some of them did not afford the medical costs that came with it. So what we're trying to do is to make sure that people can access specialized medical attention cheaply, affordably. We can enable you see a specialist at a negotiated cost without having to spend money to travel abroad. So you can be seen by a specialist in India or Israel while you're here, and you cut out all the costs of buying air tickets, processing visas, accommodation, and everything. So it makes it accessible, but at the same time affordable to all the common people, so they can be accessed to proper treatment.
Is that what is called telemedicine?
Yes. Right now we operate a telemedicine center that enables us connect to specialists all over the world. We have a team of specialists domestically that collaborate with specialists internationally to get proper treatment for patients.
Okay.
But I wanted to tell you some good news that are coming out. Like I told you, I'm a health enthusiast and a proponent of longevity.
A proponent of longevity.
And the latest reports coming out from the anti-aging and longevity industry shows that now humans have the capacity to live up to a minimum of 100 years when they are fully functional. When they are fully functional and healthy. And we want people to change their lifestyles to make sure that they can live that.
They can live longer.
And the latest reports also show that, especially now in the most advanced medically advanced in technology, like countries like Hong Kong, countries like South Korea, countries like Japan, where people have been living for long, they are showing that people can even go beyond 100 and live to 120, 130 years. It is very possible here, as long as we emphasize preventive medicine. Preventive medicine is us taking the responsibility to make sure that we change our lifestyles. Because research is showing that if you give up alcohol, if you quit smoking, if you sleep well, if you eat good food, if you do exercise, you can prolong your lifespan. And this is very possible. And what disturbs me sometimes is that we don't even do the things we can do just because we don't take it serious, or we have different interests. Have you ever asked yourself why you go to a hospital that well knows that most of the illnesses that the patients that go there are caused by bad food, and you find them operating a restaurant that sells junk food, bad food in a hospital?
Those are the contradictions of capitalism.
Those are things that really show that some of these people don't care about you as a patient recovering, because they are treating you of an illness that is caused by bad food, and they are selling you the same poison at the same time
within the restaurants and the hospitals.
Yes. So there are enormous challenges that we want to address, and we think that it will take the change of a mindset of everybody that is involved, and us as the local population, to make sure that we take measures to prolong our life.
All right, when you talk about the fact that it will take many stakeholders, I would love to engage on the collaborations, if at all there are any, that are being undertaken between players like you and the government, because the public health care infrastructure is wanting, and usually a collaboration like yours ought to be able to play well into interventions that are being rolled out by the government. I don't know whether this conversation has been initiated by you, and whether you're receiving any good signals in as far as talking to government or the Ministry of Health is concerned.
We are reaching out to different stakeholders, especially those in authority, to do what is within their means to help the situation. There are so many challenges that we can start with, small things that can be handled.
That's right.
Without any costs involved. I don't know if you've heard of pastors that still proclaim to have healing power. Do you know how many people have lost their lives because of the propagandas and the messages that are put out by such people? They tell people that they have healing power, and people don't go to get scientific treatment, believing in their pastors that probably they can heal them. It is a challenge that if we don't solve even the simple problems, we cannot solve any problem at all. And you've heard also in the news when they've had to close down medical centers because they are operated by people who are not qualified, or they found them having drugs that are below standard. So there are things that we can work on to make sure that we correct the system, because the problem is bigger, but we cannot keep blaming those who were waiting to come and save us, but we have to take responsibility and make sure that as we wait for government to do their part, we should also start to do some small changes to make sure that we correct the situation.
All right. Thank you very much, Mr. James Yiga, Director at Light Travel Consultants, for what is no doubt an eye-opener when it comes to being healthy, but most importantly, doing preventive medicine in order to stave off the huge costs of seeking treatment, especially abroad. It's been a pleasure.